Welcome to our channel, Hashmi Clinics.
All right, today we're going to tackle Ailanthus Glandulosa, the tree of heaven. And let me tell you, this is an absolute lifesaver. We're talking about those really terrifying acute cases where you see a rapid septic collapse. Frankly, getting this remedy picture locked in your mind is non-negotiable for any serious homeopath. So let's get right into it. So here's how we're going to build the picture. We'll start with the very core of the remedy, its essence of malignancy. Then we'll layer on the mental picture, the way the body collapses and its prime targets, the throat and skin. We'll wrap it all up with where you'll use it clinically and how you can prescribe it with real confidence.
Okay, let's get right to the heart of it. The entire Ailanthus state is driven by one thing: a sudden, overwhelming septic collapse. Just imagine the vital forces being completely poisoned from the inside out. This is that low, zymotic terrain where Ailanthus is an absolute king.
This quote right here, this gives you the 4 unshakable pillars of the remedy. You need to burn these words into your brain. Lividity, that's that awful, purplish, dusky skin. Stupor, a profound dullness, almost semi-conscious. Photor, that offensive odor from every single discharge. And malignancy, the sheer speed and destructive power of the illness. These 4 words, they're the key that unlocks the whole remedy. And this term, adynamia, it is absolutely central to understanding Ailanthus. We are not just talking about feeling a bit weak here. No, this is a complete and total shutdown of vital power. It's the kind of state you see in the worst forms of diphtheria, scarlatina, sepsis, anywhere the patient is sinking and sinking fast. So what does this catastrophic physical collapse look like in the mind? Well, as you can probably guess, the mental picture is a perfect mirror of the physical. It's a rapid, predictable, and frankly, terrifying descent into chaos.
And the progression is just shockingly swift. It might start with simple dullness, they just can't concentrate. But that quickly sinks into this deep stupor, a kind of indifferent, semi-conscious state. From there, it can devolve into a low, muttering delirium, or it can just explode into a full-on raging delirium where the patient is completely gone, disconnected from everyone and everything.
And here's where you get those really strange, peculiar mental symptoms that just scream Ailanthus. The memory loss is profound. It's like their whole past just belongs to somebody else. And you have to pay close attention to the delusions, seeing or feeling things like rats or snakes crawling on them. When you hear that, your Ailanthus alarm bells should be going off. These are unmistakable keynotes.
All right, now for the physical generals. And as you'd expect, this theme of malignancy and rapid decay, well, you see it reflected all across the patient's entire system.
And this right here, this is a massive keynote. The prostration is immediate. It's not a weakness that builds over a few days like in some other remedies. No, the Ailanthus patient collapses almost from the first hour of the illness. This sudden, extreme weakness right at the very beginning is one of the most powerful signals you will ever get for this remedy.
The modalities give us even more clarity. Just look at the profound aggravation from sitting up. It can cause violent vomiting and dizziness. And a huge trigger for this entire state is often the suppression of an eruption, right? Like a case of measles or scarlatina, where the rash just didn't come out properly. And also notice that very peculiar little detail. In bronchial affections, they're actually better from lying on the right side. It's a small but very telling clue.
Ailanthus really focuses its destructive force on 2 main battlegrounds, the throat and the skin. And in both places, you see the exact same picture of circulatory collapse and septic decay.
I mean, just look at the parallels here. The throat isn't just red, it's dark, purple, livid, so swollen it looks like it would pit on pressure. The tonsils are covered with these deep, angry-looking ulcerative craters. And the skin, it's a perfect mirror. A dusky, mottled, patchy eruption that's scanty and often has a bluish tint. The pathology is identical in both places.
And here it is. This is your gold standard confirmatory symptom. You press your finger on that livid, patchy rash, and if the white mark you make fills back in very, very slowly, you are looking at Ailanthus. It's a perfect demonstration of the profound circulatory stagnation that's at the very heart of the septic state. So, where are you actually going to use this remedy in your practice? Let's get practical and look at the specific clinical situations where Ailanthus is just indispensable.
JT can't really hit the nail on the head.
He said the most striking use for Ailanthus is in malignant scarlet fever. And he's absolutely right. We're talking about the worst of the worst cases, the ones where the rash is suppressed or just won't develop properly, the throat is horrifically swollen and septic, and the child is just sinking rapidly into that stuporous typhoid-like state.
But it's not just scarlatina. Its sphere of action really covers any low, adynamic state. Think septic diphtheria with that same livid throat and profound prostration, or a follicular tonsillitis that's just gone rogue and become malignant, overwhelming sepsis or blood poisoning, and especially you have to think of it in those cases where a simple fever suddenly turns septic after an eruption has been suppressed.
Now, to prescribe Ailanthus with real confidence, you have to know how it stacks up against its closest relatives in these septic states. So let's do a quick comparison.
This table really gives you the key differences at a glance. So Baptisia has that more besotted, kind of drunken appearance and famously falls asleep in the middle of a sentence. Lachesis is marked by that incredible talkativeness, suspicion, and a hypersensitive throat that's worse on the left side. Then you have Aurum triphyllum, which shows intense irritation. They're picking their nose and lips until they bleed, and the discharges are incredibly acrid. But see, none of them have that unique Ailanthus signature, that profound stupor combined with an immediate overwhelming prostration right from the very onset.
So let's lock this in. These are your clinical anchors. When you see that triad of lividity, stupor, and malignancy, Ailanthus has to pop into your head. If the prostration was there from the very beginning and you can confirm it with that slow-to-return rash, you've got your remedy. It is your go-to when a case takes a sudden, terrifying turn for the worse.
And really, that's the question to carry with you into your practice. The next time you're faced with one of these zymotic cases with that rapid collapse, will you recognize the face of Ailanthus? Mastering this remedy picture means you'll be prepared to act decisively when a patient's life is on the line. It's a tool you'll be very glad to have. Thank you.
Professor Dr. Rafat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rafat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.